Imagine a world where doctors can guide life-saving procedures with pinpoint precision, like having a GPS for the human body. That's the power of medical imaging, and today we're diving into how researchers are making these technologies smarter, faster, and more accurate. Let's start with the problem. Traditional 2D ultrasound scans, while real-time and portable, show flat cross-sections of the body. For procedures like liver tumor ablation, where doctors insert a probe to destroy cancer cells with heat, this creates a mental puzzle. They have to mentally reconstruct 3D anatomy from 2D slices, a process prone to error, especially with small or irregular tumors. Enter 3D ultrasound, a game changer. Think of it as upgrading from a flat map to a 3D globe. It provides a volumetric view of the liver, reducing guesswork. But integrating 3D US with other imaging modalities like CT or MRI, critical for accuracy, has been a technical hurdle. Here's the breakthrough. Researchers developed a framework that bridges 3D US with existing tools. Imagine a robotic arm holding a 3D ultrasound probe, automatically capturing multiple 2D slices. These are stitched into a 3D image in 7-12 seconds. But the real innovation lies in registration, the process of aligning images from different sources. They split this into two steps. First, matching 3D US with CT MRI scans, then using that alignment to guide real-time 2D US. This two-step approach simplifies a complex task. To achieve this, they combined rigid and non-rigid registration techniques. Rigid alignment is like sliding images into place without bending them, while non-rigid allows for flexible adjustments. Think of stretching a rubber sheet to fit a shape. This non-rigid method cut alignment errors by 40%, achieving 2-4 mm precision. But how does it work in practice? A visual tool overlays CT MRI images onto the 3D US view, showing the liver in 3 planes, front, side, and top. This multimodal visualization lets doctors verify alignment in real time, even during a procedure. The results? Alignment takes just 0.22 seconds, fast enough for real-time use. And the framework integrates seamlessly into existing workflows, meaning hospitals could adopt it without overhauling their systems. Now, let's dig deeper into the math behind this. At the core is the Marquardt algorithm, a mathematical method that fine-tunes complex calculations. It's like a super-efficient calculator that adjusts parameters to make images match, even when they're from different sources. This technique has been crucial in everything from robotic surgery to cancer treatment planning. Take prostate biopsies as an example. Traditional methods rely on guesswork, but modern systems use 3D ultrasound guided by MRI. By fusing these images, doctors can target suspicious areas with remarkable accuracy. Studies show this reduces translational errors, how far off an image is in space, and rotational errors, how misaligned it is in orientation. In one study, researchers tested 2 calibration methods. The first, arm calibration alone, had errors of 7 in translation and 5 degrees in rotation. But when they added probe calibration, a more precise method accounting for the ultrasound device itself, the errors dropped to 2.8 and 9 degrees, cutting inaccuracies by 2/3. For registration, they compared rigid and non-rigid approaches. In healthy volunteers, non-rigid registration reduced vessel alignment errors by 47.7% compared to rigid methods. For patients, it brought errors down to around 2 clinically acceptable. Why does this matter? Imagine a surgeon using real-time ultrasound to guide a needle to a tumor. Even a tumor error could mean missing the target. This research shows that combining advanced calibration with non-rigid registration creates a system that's both precise and adaptable, critical for complex cases like liver tumors, where organs shift and deform. The study also highlights speed. Non-rigid registration takes seconds to minutes, making it practical for real-world use. And the system's ability to handle tricky scenarios, like overlapping images or shadows in ultrasound, shows its robustness. So what's next? While the results are promising, more patient studies are needed to refine the technology. But the implications are clear. This framework could revolutionize minimally invasive procedures, reducing risks and improving outcomes. In a field where every millimeter counts, these advancements are more than technical wins. They're steps toward a future where precision medicine becomes the norm. Thanks for watching and stay curious, because the next breakthrough is just a scan away.